I am Dr. Raviraj, Senior Consultant Orthopedics, Joint Replacement and Arthroscopic Surgery at Apollo Hospitals, Bannerghatta Road. I am going to talk about arthroscopic ACL reconstruction. ACL is the commonest ligament that is damaged in young active patients either due to sports injury or due to road traffic accident. Even trivial falls at home also can cause ACL tear in some patients. Now, in young active patients, the best treatment for a complete ACL tear is what is called as a arthroscopic ACL reconstruction. In this surgery, we take a hamstring graft from the same knee of the patient and we reconstruct the ligament by keyhole technique. So immediately post surgery, patient will be mobilized with full weight bearing walking and active knee bending exercises from day one itself. We follow aggressive rehabilitation protocol where the knee is mobilized and patient is made to walk from the day one post surgery. Patient will be in a brace during the rehabilitation procedure for about 6 weeks, during which the exercises will be taught to strengthen the muscles and to get the range of motion of the knee. Once this rehabilitation is over, patient is able to do all his activities including his sporting activity without any pain.